Hi, my name is Michelle Dill. I'm here to discuss baby boomers and the effect on the healthcare industry. Baby boomers were born during 1946 through 1964. During that time period, 76 million babies were born versus the previous generation of the silent, which were only 55 million. So that's a big jump. There are several key issues that need to be discussed on how they will affect the healthcare industry, such as, of course, increase in patient flow. Once they start retiring, they're going to need more patient care. Their longer life expectancies are coupled with more chronic diseases. They're not the healthiest of generations. Increase of Medicare, Medicaid, and Social Security. The more that retire, the more money is needed to take care of these individuals. Our workforce is going to be reduced considerably once they start retiring, since a lot of the baby boomers are within the healthcare industry, such as physicians and nurses. Once they start retiring, this workforce will have a huge gap that needs to be filled. Long-term health industries, they're going to have the most strain because they're going to need to ensure that their industry can cope with the amount of individuals that are going to need long-term care. As you get older, you tend to need more care, such as everyday necessities, bathing, feeding, clothing. A lot of individuals that reach 80, 85, they can no longer live at home. So these organizations need to ensure that they have enough beds, they have enough workforce to take care of these individuals, and so forth. Increase in patient care, like I said. 2011 started the first portion of the baby boomers generation retiring. By 2030, there's going to be 64 million baby boomers that are going to retire, and that's about 20% of the total population. Again, their life expectancy is longer. It's between 78 to 82 years old. Unfortunately, being that they're not the healthiest generation, there's going to be a lot of care that's associated with them. Cancer rates have tripled in their generation. Obesity is a huge issue. They're about 38% versus the previous generation of 29% of the population having issues with obesity, and obesity also causes other health issues. Rising costs associated with Medicare, Medicaid, Social Security. Taxpayer burden for more citizens in Medicare and Medicaid programs. Citizens right now are already paying a lot of money toward funding these programs. When you incorporate even more into those programs, that means more taxpaying money needing to fund it. Reduction in the workforce. Again, 76 million people currently are near the age of retirement. Small businesses may close due to the retiring baby boomers. Health administrators will need to find ways to fill these gaps. Baby boomers retiring, your organizations can develop programs that can retain these employees by adding part-time employment, employing them as consultants. Also, administrators need to focus on ways to entice new employees coming into the workforce. You got to be able to fill that gap, or else you're going to have a supply and demand issue. Long-term care, nursing homes, assisted living facilities, skilled nursing facilities, informal caregivers. Big impact will be felt in this field with overcrowding and staff shortages. Growth in the industry was 55 million in 2010. Now they're approximating it to be 8.7 million in 2030. Facilities need to determine if the best avenue is to increase or expand their divisions, adding more beds, adding more employees, giving incentives on informal caregivers, which are family members that take care of their parents in the home. Find incentives, tax breaks, anything to help reduce the strain on the long-term care facilities. Administrators can be the forefront of this. They can start developing programs to help educate our older generation on how to better take care of themselves. Start exercise programs, material that discusses the health issues that are riddling this generation. There's ways to combat this and to reduce the strain on the overall healthcare industry. Well, I hope you've enjoyed this presentation, and thank you very much.